Many men in their 60s are facing the same quiet frustration. Their prostate is causing problems, and their sex life isn't what it used to be. Maybe you're running to the bathroom constantly. Maybe you're waking up multiple times at night. And maybe you've noticed that firmness isn't what it once was, or it's gone entirely. Here's what I need you to understand. These two problems aren't separate. They're connected. And here's the most important part. Both are treatable. I'm Dr. Sarah Mitchell, and I've spent over a decade as a urologist working with thousands of men just like you. Today, I'm going to explain the hidden link between prostate health and sexual performance. And more importantly, I'll show you how to support both. By the end of this video, you'll understand how your prostate affects your erections, what warning signs to watch for, and exactly what to ask your doctor. I'll even share natural strategies you can try before reaching for medication. Let's get started, because prostate problems don't have to destroy your sex life. First, you need to understand this. Your prostate is a critical part of your sexual system. It's a walnut-sized gland sitting just below your bladder, wrapped around the urethra. It's right in the middle of the pathway for both urine and semen. As you age, most men's prostates grow larger. We call this benign prostatic hyperplasia, or BPH. Over half of men over 60 experience this. You're not alone. Now, when the prostate enlarges, two things happen. First, it presses on the urethra. That's why your urine stream weakens. You can't empty completely, and you're up multiple times at night. These are the symptoms you know about. But here's what most doctors don't clearly explain. An enlarged prostate also puts pressure on the blood vessels and nerves that supply your penis. This can be why your erections are weaker or disappearing entirely. Think about it. Erections are all about blood flow. The arteries leading to your penis need to open wide, blood needs to rush in, and it needs to stay there. But when the prostate enlarges, it can compress those blood vessels in the pelvic region. Flow slows down, nerve signals weaken. The result? Weaker erections, shorter lasting firmness, or no erection at all. And then there are the medications. Many drugs prescribed for BPH directly affect sexual function. Alpha blockers, for example. They improve urine flow, but some reduce libido or cause retrograde ejaculation. That means you orgasm, but the semen goes backward into your bladder. 5-alpha reductase inhibitors do the same thing. Drugs like finasteride or dutasteride. They shrink the prostate, but I see many men experience loss of desire, difficulty with erections, and even depression. This is why treating just the prostate isn't enough. You have to consider how that treatment affects your sexual health. So what can you do? Step 1 is awareness. If you're experiencing both prostate symptoms and erection problems, they may be linked. Talk to your doctor about both, separately and together. Step 2 is reviewing your medications. Ask your doctor directly. Does this medication affect my sexual function? Are there alternatives? Some drugs have fewer side effects. Step 3 is exploring natural support. Lifestyle changes, targeted exercises, anti-inflammatory nutrition. These support both prostate and sexual health. Let's dive deeper into these solutions. Start with diet. What you eat has a direct impact on inflammation, blood flow, and hormone balance. All of these affect both your prostate and your erections. Foods rich in lycopene, like tomatoes, have been shown to support prostate health. Lycopene is a powerful antioxidant that reduces inflammation in prostate tissue. Cooked tomatoes are even better because heat releases more lycopene. Zinc is critical for both prostate function and testosterone production. Pumpkin seeds, oysters, and lean meats are excellent sources. Many men over 60 are deficient in zinc, and this directly impacts sexual performance. Omega-3 fatty acids from wild-caught fish, walnuts, and flaxseed help reduce inflammation throughout the pelvic region. Inflammation is a major driver of both BPH and erectile dysfunction. Avoid foods that worsen symptoms. Excess caffeine and alcohol irritate the bladder and can make urinary symptoms worse. High sugar and processed foods increase inflammation and restrict blood flow. Next, let's talk about physical activity. Movement is medicine, especially for the pelvic region. Aerobic exercise like brisk walking or cycling improves circulation throughout your body, including to the penis. Studies show that men who exercise regularly have significantly better erectile function than sedentary men. But there's one type of exercise that's particularly powerful for both prostate and sexual health. Pelvic floor exercises, also known as Kegels. Your pelvic floor muscles support your bladder, control urination, and play a key role in erections. When these muscles are strong, they help trap blood in the penis during arousal, creating firmness. When they're weak, erections fade quickly. Here's how to do them correctly. Sit or lie comfortably. Tighten the muscles you'd use to stop urinating midstream. Hold for 3 to 5 seconds, then release. Start with 10 repetitions, 3 times a day. Over time, increase the hold to 10 seconds. These exercises improve bladder control and strengthen erections. Many of my patients notice a difference within 4 to 6 weeks. Now let's address the elephant in the room: medications and their side effects. If you're taking medication for BPH and experiencing sexual problems, you need to have an honest conversation with your doctor. Don't suffer in silence. Alpha blockers like tamsulosin or alfuzosin relax the muscles around the prostate and bladder neck, improving urine flow. But they can also cause retrograde ejaculation or reduced libido in some men. 5-alpha reductase inhibitors like finasteride or dutasteride shrink the prostate by blocking DHT, a hormone linked to prostate growth. But DHT is also involved in sexual function. Blocking it can reduce desire and cause erectile difficulties. Ask your doctor these questions. Is there a lower dose that still helps my prostate but has fewer sexual side effects? Can I try a different medication? Are there non-drug options I should consider first? Sometimes switching medications or adjusting the dose can make a significant difference. And in some cases, combining a lower medication dose with lifestyle changes gives you the best of both worlds. There are also natural supplements that may help, though you should always talk to your doctor before starting any. Saw palmetto has been used for decades to support prostate health. Some studies suggest it may reduce urinary symptoms with fewer sexual side effects than prescription drugs. Beta-sitosterol, a plant compound found in nuts and seeds, has shown promise in improving urine flow and reducing prostate inflammation. Pygeum, derived from African plum tree bark, has been studied for its ability to reduce nighttime urination and support bladder function. Again, these are not magic cures, but they may provide gentle support when used correctly and under medical supervision. Let's also talk about stress and sleep, 2 factors that profoundly affect both prostate and sexual health. Chronic stress raises cortisol levels, which suppresses testosterone and tightens blood vessels. That means less desire, weaker erections, and more inflammation in the prostate. Poor sleep does the same thing. Testosterone is produced during deep sleep. If you're waking up multiple times at night because of your prostate, you're not getting that deep restorative sleep your body needs. This creates a vicious cycle. Prostate symptoms disrupt sleep. Poor sleep lowers testosterone. Low testosterone worsens both prostate symptoms and erectile function. Breaking this cycle requires a multi-pronged approach. Manage stress with deep breathing, meditation, or gentle movement like yoga. Improve sleep hygiene by keeping your bedroom cool, dark, and quiet. Limit fluids 2 hours before bed to reduce nighttime bathroom trips. And consider working with a sleep specialist if nighttime urination is severely disrupting your rest. Sometimes, adjusting medication timing or adding a targeted supplement can make a huge difference. Here's the reality. Prostate problems and erectile dysfunction often go hand in hand after 60, but they don't have to control your life. With the right combination of medical treatment, lifestyle changes, targeted exercises, and open communication with your doctor, you can support both your prostate health and your sexual vitality. Your action plan starts today. Schedule an appointment with your doctor. Be honest about both your prostate symptoms and your sexual concerns. Ask about medication side effects and alternatives. Start eating more anti-inflammatory foods. Begin pelvic floor exercises. Manage your stress and prioritize sleep. Small, consistent changes add up to real improvements. You don't have to accept decline as inevitable. If you found this helpful, please subscribe for more evidence-based men's health guidance. Share this video with someone who needs to hear it. And drop your questions in the comments. I read every one. This is Dr. Sarah Mitchell reminding you that your prostate health and your sexual health matter at every age. Take care of both, and you'll feel the difference.